I wanted to know if anything could be done for me through a PRP procedure. I really need help with my hair, and I am struggling in my everyday life to cope with this situation. I am a 31-year-old mother of two.
Thank you for your question. You've submitted several photos and you're asking about the use of PRP to help with your hair loss. And you describe a little bit about your personal situation. So I could certainly give you some guidance on the role of PRP and what solutions are available to you. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice for over 20 years in Manhattan and Long Island. I'm also the founder of TrichoStem Hair Regeneration Centers. This is a technology we developed in our practice to non-surgically help people with hair loss using platelet-rich plasma as well as other things that was developed from our application of this technology for hair transplant surgery. So a situation like yours is something I'm quite familiar with. To begin with, we have to understand, first of all, the causation, or what's the basis for your hair loss. From the photos you submitted, my first thought is that these areas are diminishing of hair at the temporal areas of your scalp. I think that from my experience it's caused by something called traction alopecia. And this is very common for people who have braided their hair or did very tight types of hairstyles where the skin was under tension from the hair being pulled very tightly. Basically, with traction alopecia, the hair follicle eventually stops growing because of the tension, traction. Now, in a related type of situation for people with your skin type, and I'm assuming is someone of African descent, is that we've also seen comparable situations for people who have used hair relaxers. And hair relaxers are basically chemicals that disrupt the bonds in the hair to realign the proteins in a way that causes straightening. Unfortunately, these relaxers can also cause skin burns and can result in hair loss as well. Now, since your situation looks more like traction, but in the end, there's probably some overlap in the way we would treat your situation. So when it comes to PRP, a little bit of guidance from my experience. We use PRP in our practice a lot. We use it every day for a variety of reasons. As a cosmetic surgeon, as someone who does lasers and non-invasive treatments and microdermabrasions and various other, and microneedling. Platelet-rich plasma is wonderful. We use it for acne scars, we use it for wrinkles, we use it for dark under-eye circles, we use it in combination with fillers. But when it comes to hair, platelet-rich plasma can stimulate hair growth. But in my experience, it's not sustainable stimulation of hair growth. In our practice, we use something called hair regeneration. And hair regeneration is a combination of platelet-rich plasma with a material called extracellular matrix. Now, we use this mainly for genetic pattern loss, male and female hereditary loss. I have found it to have limited value with traction alopecia. However, when we look at someone, when we do a microscope examination, I often will tell the patient that in order to see what we can maximally get from your scalp, whether there is any salvageable hair follicles that might be in injured state, there's value to trying something like hair regeneration as opposed to PRP alone. But to get density, to restore benefit, we usually have to do some kind of transplantation. And that gets tricky because the space that you need hair is a fair amount. And so you would probably need a fairly extensive hair transplant procedure. And very often it's necessary to have more than one. But I think in a stepwise methodical approach, you have to do everything to prevent further traction alopecia. That means changing hairstyles. And I think that, unfortunately, reality is a lot of people are resistant to it, and often are just, that's their look. And we do a lot to counsel our patients to try to manage that. Because if you keep putting tension on your hairs, you'll lose more hair. There have been some patients who actually did this traction maneuver to try to lift their brows, and they lost their hair from that, so I wouldn't advise that as well. But that being said, I think a stepwise approach does make sense. Hair regeneration technology to first maximize whatever growth there is, and then transplantation done in a way that makes sense to both you and your physician. So learn about these options, about hair regeneration and transplantation, and then do some consultations with doctors who specialize in hair loss treatment and hair transplant, and move forward from there. So I hope that was helpful. I wish you the best of luck, and thank you for your question.